Hey y'all, welcome back, friends. I'm so glad that you're here. Today is Sunday. It's Sunday for me, so wherever you are, we are recording and bringing you new content. This week is we're going to be talking about the medication part 6. We're doing the medication series. If this channel has been helping you and if this channel is allowing you to study and retain the information for the PharmTech exam, please make sure that you subscribe, ring the bell for notifications so you can stay up to date as to when we post new content, okay? Please make sure that you are sharing, you are liking, and if you can, drop a comment in the comment section. I want to know what you're studying. I want to know where you are. I want to know if you've taken the exam before. I want to know if this is your very first time taking the exam. I want to know if you've taken a course before. I want to know about you, okay? I want to make sure that I'm helping you and that the information I'm giving you is helping you to move forward and to retain the information, all right? So we're about to jump into medication part 6. This is the series. If you haven't been keeping up, please go back and watch the previous videos so you know where we are. I believe there are going to be about 10 to 12 parts all together. So you're in for a real treat. We're going through all the top 200 drugs to make sure that you are ready for medications. Why? Because medication is 40% of your exam. I repeat, medications is 40% of your exam. So it is your responsibility to know these drugs. Grab your paper, grab your pencil, grab your headphones, and get ready because we're about to jump into the content. Okay, so the first one is administration instructions. Administration instructions is a part of the 40% of medications, so you should definitely be aware of this. If a patient is taking Fosamax is for osteoporosis, okay? Osteoporosis is a condition of the what? The bones, hence the little leopard bone at the bottom, right? So with that being said, you're looking at all of the things that the patient should do when they are taking Fosamax, and we want them to take Fosamax with water, okay? Administration instructions mean how are they taking the medication, right? We know that they are taking it, by mouth is what we assume. If they're using it with water, that means they're taking it by mouth, right? So administration is the way that the drug is taken, all right? Now, this is a trick question, and I want to know if you know the answer. Who administers drugs to the patient? Who does the administrating of the drug to the patient? Is it the pharmacist? Is it the doctor? Is it, or is it the patient? And in this instance, it would be the patient who's administering the drug to themselves, right? Administer means who's giving the drug, all right? Remember, in pharmacy, all we do is dispense. We do not administer. That is something you want to remember. The next one talks about drug classifications, okay? So the drug classifications is the way that the drug is categorized, right? How is this drug categorized? Is it categorized as a beta blocker, a calcium channel blocker? Is it categorized as a loop diuretic? What is it? Well, the drug is furosemide. Say that with me, furosemide, right? Look, in one of my videos, I said it didn't matter if you can pronounce these drug names. Baby, let me tell you something. I got LW has a new partner that we're working with. And when we're talking to the patients, we're having to really pronounce these drugs because they can't see the drugs because we're talking to them over the phone. And I said to myself, all this time I've been saying, you don't get paid to pronounce these drugs correctly and so on and so forth. And true enough, the partners are not dinging, anybody for not pronouncing the drug correctly, but it does help the patient when you're talking to them if you can pronounce the drug name correctly, okay? So I am going to be trying my best to make sure that I am enunciating and articulating well so we can remember these drug names. So furosemide, right? Furosemide, what is the brand name to furosemide? Is furosemide a generic or a brand? Furosemide is a generic and the brand name is Lasix. Now, if you are studying drugs and you don't know that, that means you need to download my ebook, and I'm going to show you that in a few slides coming up. But hopefully you've answered this question. It says, to which drug class does furosemide belong to? And that is loop diuretic, right? A diuretic is nothing but a fluid pill, hence the picture of the water. It's getting the fluid retention off of the body, okay? So you want to make sure, again, you know that. And if you don't know that, that is because you need my ebook so you can retain this information in an interactive, fun way, okay? The next one, we're looking at Schedule 5 drugs. Schedule 5, right? Schedule 5 is very important because you need to know not only is the drug a Schedule 5, but you also need to know the refills of a Schedule 5 drug. So if a drug is a Schedule 5, it has 5 refills within a 6-month period. You better write it down. I told you, baby, we going all the way. 5 refills within a 6-month period, okay? Now, we're looking at Lyrica. What does Lyrica treat? Nerve pain. Lyrica treats nerve pain, hence the picture in the right of the screen. Nerve pain is what Lyrica treats, okay? And since Lyrica treats nerve pain, and most drugs that treat pain or some type of narcotic, some type of scheduled drug, especially if it's some intense pain, because we know that anything that is used to treat pain can become addicting, right? I was just sharing with my children that once I finish recording this content, I am going to go watch the new show on Netflix. I think it's called Painkillers. It has something to do with pain, but I've been waiting on the show to hit Netflix, and it's finally there. So once I'm done with this recording, baby, I'm jumping over to Netflix. Side note, go watch it if you haven't seen it. I don't know if it's good, but I do believe doing these things in your everyday life, it can also help you retain this information, and it can allow you to understand why drugs are scheduled the way that they are and the side effects that they can have, not just on the patients, but also on the community, okay? Hopefully you got the answer while we were talking, and the correct answer is C, pregabalin. Pregabalin is the generic name for Lyrica, friend. Okay, friend, guess what we did? But look at what we have done. Look at what we did for you. We put this on Amazon. Okay. Y'all said y'all wanted an ebook. Y'all said y'all needed help retaining this medication. Y'all said that this was something that you wanted help with. And so what we did was we put the book on download so you can get it. The book is now on Amazon. It is only $4.99. You can download it and you have instant access to this book. I believe you're going to enjoy it. Me and a colleague of mine completed this book, and it has helped people all over the country to study and pass the board exam. These are what the digital flashcards look like. I was not able to zoom in on it. And so, but if you get the book, you can see it very clearly. But we have put some fun pictures in here so you can see that it is a child or a young girl who is sick. And my little Zoom thing keeps showing. I don't know if y'all can see that or not, but the little girl is sick and it is ondansetron. And we know that ondansetron is used to treat nausea. The drug is introducing itself. So this is kind of like an interview card, right? Or kind of like a drug bio, right? So it's like, hi, my name is Zofran. I am used to treat nausea. I can impair your thinking and reactions, so be careful when you're driving while taking me, right? So that is what Zofran is, and so it is used to treat nausea, and then it just goes on to talk about the way that it comes, make sure you avoid alcohol and all of that, right? So it's a very interactive study guide that will allow you to really put not only the name, but you can see the side effect and you can see the pictures. I know for me, I need to see pictures and images and, really get into it so I can make sure that I can remember it, right? So hopefully you will, find this helpful and leave me a comment in the chat below so we can keep in contact. And I definitely want to make sure that you give me your feedback because everything we're doing is to help you help to support you be a better you, okay? The next one we're going to get into is administration instructions. This is another one because remember, medications is worth what? 40% of your exam. You're going to know that before this is over. Everybody wants to focus on math. That is not worth 40%. Medications is worth the most. Which of the following meds should be taken with food? And that is prednisone. Prednisone is a steroid, and so it can cause weight gain and moody behavior and hunger because you are hungry, so you're gaining weight, right? So you definitely want to make sure you are familiar with these different type of drugs. If you see the OLOL here, you know that means that drug is used to treat high blood pressure, because if you've been following my videos, you know we talk about the suffixes and the prefixes and the infixes of a drug. And we also point that out in that ebook. So if you've been following and studying with me, you would have known when you saw OLOL that was a beta blocker, and it is used to treat what? High blood pressure. Don't play with it. Don't play with it. Don't play with it. Okay. Which of the following medications may result in drowsiness as a side effect? Side effects are important because if a drug is affecting a patient in a negative way, do you think that they're going to continue to take that drug? No, they're not. Most patients will discontinue taking the drug. Some of them will tell their doctor why, and some of them won't just take the drug and they won't communicate why. And now we have an unhealthy person and the therapy doesn't work. And we don't know that because the patient didn't share that. And so now the patient is still walking around with the same condition, and it could have been fixed if they would have shared that. And if the doctor knew it, they could have put them on something that could have been a little bit more helpful, because everybody's responds to the medications differently, right? Everybody's bodies respond to the medication differently, okay? So we always want to encourage our clients, patients, customers, friends, whomever we are helping with the medication therapy, to report side effects. The side effects of Benadryl, which is also known as letter B, is drowsiness, right? And if you look here, you will see that is the generic of Benadryl. Drowsiness is a side effect. Write that down. Write that down, okay? Let's look at generic names, right? So now we're talking about simvastatin. And you know that I have taught you that anything that ends in the suffix statin is used to treat what? High cholesterol, because if it's a statin, it is used to treat high cholesterol, okay? High cholesterol is one of those drugs that is pretty common, and we see that a lot, okay? We know that if the patient is taking a statin without us having to look too much, we automatically see statin, high cholesterol, statin, high cholesterol, okay? Crestor is used to treat high cholesterol. Zocor is used to treat high cholesterol, okay? So you want to be familiar with these drug names, and you want to know when you see a statin, that helps you to remember not just that drug name, but any other drug name that ends in statin, because now you can associate that with what? High cholesterol, okay? Smarter, not harder. Smarter, not harder, okay? So for this particular answer, the generic name for simvastatin, or excuse me, the brand name for simvastatin is going to be Zocor. Write that down. Zocor is the brand name. And if you're still watching this channel and you have not subscribed or rang the bell for notifications, please do so, because it helps the algorithm and it helps us to get the information out to not just you, but other people who are also studying for their board exam as well. Okay. IV drug stability. Now, when we think about drug stability, we want to think about how to maintain the drug. That means how the drug is going to stay fresh and potent and stay in a form where it is reaching the patient with integrity, that is reaching the patient with all of the ingredients, and that this drug is actually going to do what it was set out to do. Okay. Anytime something affects the stability of a drug, it will not perform to the best of the ability of the drug or what it was originally created for. And so what that does is it does not help the patient. And remember, a lot of times when we're in front of these customers, we want to encourage them to follow and adhere to the medication therapy, right? It is our job to ensure that we do no harm to these patients and that there is no medication error whatsoever at all. So when we think about what can affect the stability of a drug, we know light can affect the stability of a drug. Because baby, if you leave me in the sunlight too long, I just might melt. I start melting, okay? The pH and the temperature, because light will increase the temperature. If you are in Houston right now, honey, you know it's like 103. Baby, that sun ain't been playing with us. This a new sun. This ain't the old sun I grew up with. This a new one. Okay. And so with that being said, these drugs can begin to melt, they can begin to deteriorate, they can begin to kind of just, go bad and expire. And when it gets to the patient, it does not serve the purpose that it should be. Now, this particular drug we're speaking about here is an IV drug, right? And so all of the things may affect the stability of the IV drug, everything except for the drug manufacturer, because all the drug manufacturer is doing is making the drug. Once they've made it and they shipped it off, it's out of their hands. The stability comes into play based on how we take care of the drug while it's in our possession. So it's important that we understand how to store these drugs, because if we don't understand drug storage, then we could possibly store a drug in the refrigerator that should be kept in the room temperature, or vice versa. And so now this drug stability is melting and it has been compromised. So when it gets to the patient, it doesn't do what it should do. Make sure you are paying attention to drug stability and the storage of the drug, okay? Reconstitutable drugs. This is important. This is on your board exam. Baby, let me tell you, if you ain't wrote nothing else down, you better make sure you write this one down, okay? Because this one here, I done seen this. I done seen it, I done heard it, I've been told about it, okay? This one is on your board exam. It says maximum beyond use date. Maximum beyond use date. I give a good example and a very good analogy when we think about the beyond use date of a drug. Now, let's be clear. The beyond use date and the expiration date ain't the same thing. And I said ain't. Who gonna check me, boo? Ain't the same thing, okay? Maximum beyond use date and expiration date are two different things. The maximum beyond use date is given by the compounder, and the expiration date is given by the drug manufacturer. You better write it down. Dropping nuggets all day long, because that's what I do. The game is free, okay? And so with that being said, this maximum beyond use date is given by the compounder. Who is the compounder? The person who cooked the medicine, the person who cooked the food, right? The person who created and put the recipe together, right? So if I'm cooking chicken and I fry the chicken or however you cook it, and I put a use date, I'm gonna say, hey, this chicken is good for 2 days. Some people eat chicken longer. Some people eat their leftovers longer. You might put it in the freezer. That's your business, okay? For me, I'm probably not gonna go back to the leftover after day 1. That's just me. But whatever you do, that's your business. Do you? Because I'm gonna do me. So my maximum beyond use date on this chicken might be 2 days, 7 days. We're gonna say 7 days for the video. And so, but before I cooked the chicken, the package said that the chicken was good until August 31st. Okay. Well, based on today's date, if I think that if I eat some chicken that I cooked today on August 31st, it probably won't taste the same. I don't know if it's going to make me sick, but it's probably not going to taste the same way that it tasted when I originally cooked it on today's date. So the expiration date was given by the manufacturer, and it was on the chicken when I purchased it from the grocery store. But the beyond use date I'm giving it is 2 days or a day. I said 7 days. I'm going to say 7 days because I don't want anybody to eat it after day 7, right? So when you think about the maximum beyond use date, For this drug, and this is amoxicillin, and I know y'all saw this in y'all refrigerator when y'all was kids. Okay, don't play. I know y'all did, and everybody had this at some point, sometime. And everybody, look, I know, I saw it in my community growing up. You put it in the refrigerator, tastes like bubble gum. That's that. Medicine be cold. That's that amoxicillin. And so the amoxicillin comes in a powder form. That's why it's called reconstituted. And you add water. And when you add the water, it becomes a liquid. It turns into a suspension that you can shake. Because remember, anything that's reconstituted, we want to shake it every time we use it to make sure that all of the ingredients is mixed and dispersed the way that it should be. Okay. And so this particular drug is good for 14 days. 14 days. 14 days is good for 14 days. Reconstituted drugs. Reconstituted drugs come in a powder substance. You pour the water in there, shake it up. We put a label on it and we give it to the customer. We tell them to keep it in the refrigerator, and it is good for 14 days. 14 days. Yes, yes, yes. Come on, friend. I see you over there working and doing what you're supposed to do. Shout out to my friends. I'm proud of y'all. It says now we're looking at hyperthyroid. So, if you've been talking to me and we've been studying and we've been on this little, trip together, this little journey, I've told you that hyper means that the thyroid is high. That means it's over functioning, right? And so when the drug is operating in that way, it may cause different side effects, but this particular slide wants to know which of these drugs is used to treat hypothyroid, right? And for this particular answer, the answer is C. Now, C, it also talks about weight gain and things like that, but thyroid disease is one of the most common drugs that you may see. They are a part of the top 200 drugs, especially levothyroxine. So if you have not practiced that, please make sure you do so, okay? I've talked about levothyroxine in my previous drug content videos, and that particular drug is also a narrow therapeutic index. So if you have not seen that, make sure you go back and watch the previous video so you can understand what I'm speaking about now. This one is indications of medications, right? So it says acute coronary syndrome, thrombotic event prevention. Let me back up for a second because I don't think I said this whole video. Look, let me tell you something. If you're not highlighting these keywords, you're setting yourself up for failure. When you are taking your test and you are preparing to answer these questions, identify your keywords, honey. Now, I know you're going to take your test on the computer and you may not actually be able to physically highlight it, but you need to be in your mind pulling out the keywords. You're going to have a scratch sheet of paper. Write them keywords down on that scratch sheet of paper because it's your job to get to the right answer. Baby, it's your job. Okay? So when you are taking your board exam, highlight these keywords. Now, I don't want to see you with 8 keywords out of 12 words highlighted because that ain't keywords. That's almost the whole doggone question. You need about 4 or 5 words, okay? That's all you need. That's all you're going to need is about 4 or 5 words. When we think about acute coronary syndrome, we're thinking about veins. We're thinking about the way the arteries, right? Not the veins, the arteries, and how it's pushing through in everything that is, happening in the body, right? And so with that being said, we are thinking about clopidogrel. Y'all didn't think I was going to say it. Babe, I know how to say that. Clopidogrel. Yes. Okay. Letter A is your answer for this particular question. As I mentioned, please make sure that you have subscribed to the channel and that you have rang the bell for notifications. This has been an amazing video, and I am just so glad that I can bring new and fresh content to you every week. I am proud of you in the journey we've been on, and I hope that as we continue to make progress, that you are seeing things happening in your life, and that things are not just showing up in the pharmacy world, but that you are starting to see that you are intelligent and that you are, you are smart and you can do this. And this test is not going to win, but you are going to win. Okay. As I mentioned, y'all asked me about that ebook. I dropped the link in the description of this video. Make sure that you go and purchase your ebook so you can remember and retain the top 200 drugs, because it is worth 40% of your exam. And I got a call the other day about eligibility of the board exam. In order to be eligible to take this board exam, you need to have done two things: either completed a 500 hours in the pharmacy. You need to make sure that you've completed a PTCB recognized course. We are PTCB recognized. For more information about that, go and watch part 5 of this video, because I talk very deeply about how you can get into the eligibility of pharmacy technician certification board exam so you can take the test and pass it. Okay. But other than that, I am so proud of you. Please keep up the good work. I will see you back next Sunday, same place, same time. Keep doing you, friends. Bye.